Travis Marion. I'm one of the orthopedic surgeons and program directors here at NOSM. Joining me, I have some of our residents as well, Dr. David Seligman, Dr. Cam Elgee, and Dr. Curtis Fahy. So throughout this presentation, if you have any questions, you want to send them some private messages, by all means do so. So we'd just like to thank you all for your interest in our program. We're situated in Thunder Bay, Ontario. Smaller size city, only 120,000, but we have a huge catchment area, size of France, essentially. Within our area, there's a lot of barriers to care, and we hope that you see us as a solution to some of the issues around here. So just to give a quick overview, we take three residents per year as of this year. It's kind of between 2 and 3. We take 2 CMGs and 1 IMG. We have a comprehensive program with most subspecialties. There are some specialties that are for which residents go to Toronto for, notably tumor and pediatrics. We see this as a benefit in that you get the best of both worlds. You have a smaller center here where you have people that are invested in your education, that you're kind of a little bit under the microscope, but you still have all the benefits of the larger center as well. We have early surgical exposure, multiple electives and selectives in order to help find your career path and allow us to support you in that endeavor. And then exposure to the cultural and social fabric of rural, Francophone, and Indigenous cultures. And much like Winnipeg, wide range of outdoor and recreational activities. So if we just take a look at our program at a glance, here's a couple of photos of our staff here. We're Thunder Bay's faculty has 8 full-time fellowship-trained faculty. We do have a satellite center in Sudbury where residents have the option to study there as well under Dr. Allison as well as Dr. Hodgins. And then, as I mentioned, our residents do travel to Toronto, a total of about 11 months over the course of 5 years. And there, Dr. Jeremy Hall is the site director. Here's some more of our faculty. Like I said, we have a full comprehensive program with the exception of tumor and pediatrics. Now, pediatrics themselves still highly represented within our program. A center where you're constantly being exposed to all the subspecialties. So it's not like you're learning in silos. We're fully involved in the CBD curriculum, and that's where how we drive our academics. So our first 2 years, our first year, we do have off-service rotations. This is approximately 5 to 6 rotations, with the main goal of achieving those initial surgical foundations, EPAs, before you start to transition into your own discipline. The off-service rotations that our residents currently are participating in are emergency medicine, MCTU, a combined vascular and plastics, as well as ICU. In terms of the academics themselves, the majority of which do happen here in Thunder Bay, we have daily teaching in the mornings. Monday morning is oncology rounds, which is WebEx through Mount Sinai. Tuesday mornings are faculty-led trauma morning rounds. It's when our faculty hand over the call for the week. Wednesday mornings are elective case rounds. This has been recently implemented, where the faculty have rotating mornings and we discuss interesting cases, plan for complex cases. Thursday morning rounds, we have some off-service teaching. Sometimes this is summer anatomy. And then Friday, we have the morning dedicated ortho teaching. This is resident and faculty-led. I'm sorry about that. Now, we have additional learning opportunities. We have monthly academic sessions, typically the 3rd Wednesday of each month. This could be anything from journal clubs to professionalism to wellness nights. 2 Wednesdays per month, we have video conferenced protected teaching with University of Toronto, and this is your equivalent to your academic half days. Surgical foundations weekly in the Tuesday afternoons, and then, as mentioned, those professional development sessions. When we do have that Toronto Alliance, again, we see this as a benefit, an opportunity to network with another institution, network with the residents, faculty, and our residents participate in junior trauma at Sunnybrook, junior peds, tumor at Mount Sinai, and then senior peds. Our residents find that they're well integrated into the team. That they're not just another bystander. They're not just given the call pager. It really helps when it comes to those the last few years, getting to know what you want to do, networking, trying to establish those fellowships, reference letters, and of course, establishing study groups. And all accommodations are provided for, as well as travel, so it's not like you're on the hook for these. When we look at some of the extended external funded courses, so we do have a focus on furthering your education, trying to provide you with the experience that you want in order to help mentor you and support you into your chosen subspecialty, and as well as, pardon me, provide you with the opportunity for research projects. So we have a number of funded courses that you could participate in. Most recently, we've additionally added the International Conference for Residency Education. Here we have our current chief administrators, Dr. Seligman and Dr. Christie, along with pediatric resident chief. We have further supplemented your learning to try to enhance just the self-directed curriculum. We have a subscription to Ortho Bullets, this virtual simulation program. And sorry, the other picture didn't show up here, but we have access to, there it is. We have access to a virtual simulation learning center within the hospital itself. You don't have to go off site, and in-house cadaveric teaching as well. So we like to focus on the anatomy first thing in the academic year. This coincides with a boot camp for our new trainees, a lot of peer-to-peer education with some of the senior residents teaching the juniors, and of course facilitated by the faculty, followed by the anatomy exam, the anatomy course, and subsequently anatomy exam. As mentioned, we do participate in a lot of research, whether that's in-house, individual projects, focusing on access to care, Indigenous health. But in addition, we participate in a lot of the national databases. We have dedicated research personnel who can help you with your projects, whether that's creation of your own protocol or jump in on one. Each year, we do participate in resident-led research night. We're hoping to integrate that with some other faculties this year, and we usually bring in a guest lecturer as well. Here's our research team. So they can provide you with all the expertise you need to get your project up and running, and more importantly, follow up so they can track all your patients and have all the questionnaires filled out for you. We do have dedicated research blocks, so one of which is affiliated with your first year emergency medicine rotation, but then a dedicated research block in your third year. Now, the main site is going to be Thunder Bay Regional Health Science Center. This is a level 1 trauma center. It's the only trauma center and also the only orthopedic hospital in Northwestern Ontario. It was opened in 2004, 395 acute care beds, 70 acres. But in addition to that, we have our satellite centers. So residents have the opportunity to immerse themselves into the smaller communities in Fort Francis, Kenora, and Dryden, where basically you just operate. Provides you with an opportunity to get to know the region, the people in it, and provide care close to home. Pardon me. The satellite center is Health Science Center at Sudbury campus, as mentioned. Pardon me. So a few of those highlights: great surgical experience. You learn how to operate early on and get an early start from day one. There's no obstructed view in the OR. Our residents have at least a 1-to-1 resident to staff ratio. And if you actually look at our case logs, in the first 2 years, our residents have logged as many as 635 cases. In the first 3 months, 72 cases. And again, that's not behind anyone. That's participating either first assist or primary surgeon. So you get the best of both worlds, both a small and large program experiences. And I think the benefit of that is that mentorship where we can help identify your strengths, support you along the way, identify any areas that need some improvement, and be able to address those prior to it becoming an issue or preventing any of your promotion. We consider ourselves a family. We have, we're close knit. We have a vested interest in your success. And I think that the final program, the final product is a very strong graduating resident. We have a 100% employment rate. Out of second year, at least out of second year fellowship, all of our residents have achieved fellowships of their desire. So really proud of that. Here's some of the fellowships that our residents go on to, everywhere from throughout Canada as well as the US. And again, Thunder Bay is quite an incredible place to live. First of all, it's cost effective. So, residency is stressful enough. Why would you want to additionally have to think about how you're going to make ends meet? If you don't want to commute anymore, Thunder Bay is the place for you. Everything's 10 minutes away, including the outdoors. As you can see, there's a lot of places. This image on the left is quite literally my backyard. My house is down just below there. We have a lot of activities for our residents, both in the summer and winter, and hope to keep that going. So if you need more information about our program, don't hesitate to take a look at our website. We have an Instagram account. You can contact myself directly or our coordinator, Brooke Snow. And, match day will be, the interview day is January 27th. We'll have a social the night before that. And keep an eye out for our Instagram page because December 7th, we'll have another information session.